Autobio develops colloidal gold products, providing both etiological and serological solutions for SARS-CoV-2 detection. Autobio etiological products, SARS-CoV-2 antigen kit, and influenza SARS-CoV-2 antigen combo kit, are applied to screen patients in early infection stage and differentiate pathogens with influenza A/B. Serological products containing SARS-CoV-2 IgM IgG combo kit, SARS-CoV-2 IgA kit, and RBD antibody kit as an aid to diagnose of SARS-CoV-2 and assessment of vaccines. These convenient kits can be stored and transported at room temperature, and no auxiliary devices are required. The result can be reported within 20 minutes and is easy to interpret without professional training. Autobio colloidal gold kits contain 5 components: test cassette, sampling swab, sampling tube, dripper, and extraction reagent or sample diluent. Serological rapid tests can be applied to serum, plasma, heparin, EDTA, or sodium citrate and whole blood specimens. Before blood collection, remove the aluminum foil pouch and place the cassette on a clean, flat, and dry surface. Collect samples in accordance with correct medical practices and then add appropriate volume into small sample well. Add approximately 2 to 3 drops of the sample diluent into each large sample well. Rate the test results between 15 and 20 minutes. Nasopharyngeal swabs are directly performed on etiological rapid tests. Firstly, add appropriate volume of extraction reagent into the sampling tube. Collect nasopharyngeal swabs and then fully soak the swabs into the extraction reagent. Squeeze the swab from outside at least 5 times. Add approximate 2 to 3 drops of the sample solution into the sample well. Rate the test results between 15 and 20 minutes. The results of Autobio rapid tests are easy to rate without special training. A visual T line indicates a positive result, and the C line is applied as a control for the righteousness of measurement procedure. There are 3 possible results: positive, negative, and invalid. Positive means the patient has corresponding antibody or pathogens in the body. Negative means the suspected case is possibly not affected, but a solo detection cannot prelude the infectious possibility without test CT, NAAT, or other clinical diagnosis result. If the result is invalid, a retest is recommended immediately. Autobio, your reliable partner in diagnostics, provides fast and effective diagnostic solutions to SARS-CoV-2. Fight against the pandemic and protect your health. Severe acute respiratory syndrome coronavirus SARS-CoV-2, an enveloped single-stranded genomic RNA virus, causes acute respiratory infections disease named COVID-19. SARS-CoV-2 may develop a fever, dry cough, fatigue, and shortness of breath. The detection of the antibodies is important for an early report, quarantine, or treatment, facilitating the fight against the pandemic and the assessment of vaccine. Autobio complete SARS-CoV-2 antibody immunoassay kits, including IgA, IgG, IgM, RBD antibody, and neutralization antibody, play a role in disease detection, epidemiological survey, vaccine efficacy evaluation, and clinical treatment assessment during all stages of the epidemic. IgA, IgM, and IgG tests provide an aid in early SARS-CoV-2 detection in conjunction with nucleic acid detection and clinical symptoms. RBD and neutralization antibody tests are used to assess the adaptive humoral immune response of the recovered and the vaccinated. Serum and plasma samples can be used in the above-mentioned assays. Autobio SARS-CoV-2 antibody clear microparticles kits can be used on Autolumo A2000 Plus or Autolumo A1000 based on chemiluminescence immunoassay, providing high throughput, fast, acute and automatic results. Autobio, your reliable partner in diagnostics, provides automatic and effective diagnostic system to SARS-CoV-2. Fight against the pandemic and protect your health.